Let's get right into it. If you think liver failure is all about turning yellow, or that it's something that only happens to heavy drinkers, well, you're working with a dangerously outdated manual. Your liver is one of the most vital and one of the most stoic organs you have.
And that right there is the whole point. See, unlike your skin or your muscles, your liver has no pain receptors inside it. It's like the silent general of your body. So when it gets into trouble, it doesn't shout. No, it sends out these really subtle biological distress signals that most people, and honestly, even a lot of doctors, can miss until the damage is pretty severe.
So today, we're going to decode those whispers. Together, we're going to turn your body into a kind of diagnostic map so you can learn how to spot the very clues your liver might be sending you right now.
And we're going to start with the most accessible diagnostic tool you own, your hands. I'm serious, go ahead and hold them out in front of you as we go through this. They are a direct, real-time readout of what's going on with your hormones and your metabolism.
First up, look at your fingernails. I don't mean the tips, but the nail bed itself. See any horizontal white bands running across them? Now here's the really interesting part, the squeeze test. Press down on your nail. Do those lines kind of vanish, only to pop right back when you let go? That's the tell. It's not damage to the nail, it's a direct signal of low albumin, which is a vital protein your liver is struggling to make enough of.
Okay, now look even closer. Is the nail bed almost ghostly white, with just the very tip staying a healthy pink? These are called Terry's nails. So what's happening? Well, normally that pink color comes from tons of tiny blood vessels. But in liver disease, the tissue underneath gets all fibrous and boggy, and it literally starts to choke off that blood supply. You're seeing a physical change, right there on your nail.
And get this, it shows you just how often these huge signs get overlooked. A 2018 study found that Terry's nails were present in nearly 80% of patients with cirrhosis. That's advanced liver scarring. And yet, this incredibly obvious clue was missed over and over again during standard physical exams.
All right, now flip your hands over and open your palms. Look at those fleshy pads at the base of your thumb and your pinky. Is there a deep, kind of splotchy redness there, almost like a crimson map that doesn't cover the center of your palm? This is a classic sign of estrogen dominance. You see, your liver is supposed to act like the garbage disposal for used-up hormones. When it's struggling, it can't break down estrogen, and that extra estrogen forces tiny blood vessels in your hands to dilate. For men, this is a massive, massive red flag.
Okay, for our last clue on the hands, I want you to try the table test. Just place your palm flat on a table. Can you get it completely flat? Or do your ring and pinky fingers feel tight, like they're being pulled inward? This condition is a mirror image of what's happening inside your body. The same systemic fibrosis or scarring that's making your liver stiff is also tightening the connective tissue in your hand.
So let's move on, because this all starts to connect. When the liver gets scarred and stiff, it's like a major blockage in your body's main plumbing. Blood can't flow through easily, so that pressure builds up, and that blood starts desperately looking for detours. This creates a visible distress map all over your body.
One of the most dramatic and, frankly, shocking signs of this is called caput medusa. The backed-up blood flow literally forces its way into these tiny, fragile veins around your belly button, causing them to swell up and twist into this crazy snake-like pattern. It's a startling thing to see, and it's a serious warning that the internal pressure is dangerously high.
But where it gets even more dangerous is where that pressure goes when you can't see it, into the veins of your throat. They start to balloon outwards, becoming what are known as esophageal varices. Think of them like overinflated paper-thin tires. Something as simple as a sharp tortilla chip or even just a hard cough can cause them to burst, leading to catastrophic internal bleeding. This is, without a doubt, the single most life-threatening complication of liver disease.
Now take a look at your upper chest and neck. Do you see any tiny red dots that look kind of like a spider's body with little legs radiating out? Here's the test. Press firmly on the center. If it turns white and then you watch it fill back up with blood from the center out, that's an estrogen star. Now, having one or two can be normal, but if you have 3 or more, that's a statistically significant indicator of liver problems. It's caused by those same out-of-whack hormonal signals.
What about bruising? Ever feel like you're just covered in bruises from the slightest bumps? You might have what I call the paper skin problem. This is happening for 2 main reasons. First, your struggling liver stops making enough clotting factors. That's the glue you need to seal any leaks. And second, that internal blood pressure backs up into your spleen, causing it to swell and hoard all the platelets. Those are the patches for any holes. So with no glue and no patches, you bruise at the slightest touch.
Okay, so far we've focused on physical signs you can actually see. But some of the most profound alarms are invisible. They affect your brain, your senses, even your personality. This is when a failing liver really starts to change who you are.
Let's try the zombie flap test right now, wherever you are. Hold your arms straight out, lock your elbows. Now bend your wrists back like you're signaling stop in traffic. Spread your fingers wide, close your eyes, and just try to hold that for 30 seconds. If your hands start to uncontrollably flap forward and back, that is a major red flag. It's called asterexis. It's caused by ammonia, a potent neurotoxin, building up because your liver can't filter it. It is literally short-circuiting the signals from your brain.
This next one is a little disturbing, but it's critical to know. It's a very specific smell on the breath. It's not just bad hygiene, it's a unique, musty, sweet scent, often described as a mix of rotten eggs and garlic. This has a name, Fetor hepaticus, or the breath of the dead. It's caused by unfiltered sulfur compounds being exhaled from your lungs. If a partner or a friend ever mentions your breath has this specific scent, don't just buy mouthwash. See a doctor immediately.
And finally, one of the most maddening and commonly missed symptoms, an intense itch, specifically on the palms of your hands and the soles of your feet. And here's the key identifier. It gets way worse at night. There's no rash, but the itch is so relentless people will scratch until they bleed. This is caused by bile salts, which are supposed to be in your digestive system, leaking from your congested liver into your bloodstream and getting deposited in your skin, where they just irritate your nerve endings like crazy.
Okay, after all of those really serious warnings, we get to the most incredible part of this whole story. Your liver is the only organ in your body that can fully regenerate. I mean, you can have significant damage, but if you give it what it needs, if you create the right biochemical environment, it can heal and grow back. So now, it's time to talk about the solution.
And we're not talking about some fad detox or bogus supplements here. We're talking about pure biochemistry. There are 3 powerful science-backed strategies you can use to trigger this regeneration. Tapping into the choline factor, using coffee as a shield, and flipping your body's autophagy switch.
So here's your action plan. First, choline. Think of it like a fleet of tiny trucks that's job is to export trapped fat out of your liver cells. The 2 best dietary sources by far are egg yolks and beef liver. Second, coffee. Study after study shows that 2 to 3 cups of black coffee a day significantly reduces liver inflammation and slows down scarring. And third, autophagy. By simply having a 16-hour fasting window, you flip a metabolic switch that tells your liver cells to start cleaning house, to literally digest their own damaged parts and burn stored fat for clean energy.
Before we finish, I have to give you one last, absolutely critical warning. This is about something millions of us have in our medicine cabinets right now. I call it the acetaminophen trap. Okay, so your liver uses this master antioxidant called glutathione to safely process drugs like Tylenol. But here's the deal. When you're fasting or if you've been drinking alcohol, your glutathione levels are severely depleted. Taking acetaminophen in that state is a recipe for disaster. Your liver creates a highly toxic byproduct that can destroy liver cells almost instantly. This is the #1 cause of acute liver failure in the Western world. So the crucial takeaway is this: never ever combine acetaminophen with fasting or alcohol.
We've covered a lot of ground today, from crimson maps on your palms to the breath of the dead. But the core message, really, is simple. Your body is in a constant state of communication with you. It's sending you signals, whispering clues about exactly what's going on inside.
The power is now truly in your hands. You've learned how to read the map. You know how to interpret the alarms. So the final question, well, it isn't for me to answer. It's for you. Now that you understand the language, what is your body telling you?